Dr. Jonathan Demeter is a board-certified urologist with urology clinics of North Texas. He completed his Bachelor of Science degree at the University of Dayton in chemical engineering, then furthered his studies, earning his Master's of Science in Biomedical Sciences from the University of Toledo. He received his medical degree at the University of Toledo College of Medicine and Biological Sciences, staying in Toledo, Ohio until he completed his internship in general surgery and then residency in urology at the University of Toledo program. Dr. Demeter especially enjoys the endoscopic and minimally invasive surgeries that a urologist can offer patients to cure their ailments, including renal stones, BPH, genitourinary cancer, and urinary continence, among others. We have a lot of great content to cover tonight, so Dr. Demeter, I'm going to turn it over to you to get us started.
Hi, everyone. I just wanted to thank first Boston Scientific, but also all the participants for signing in to go through and talk about one of the most common things I treat, and that's BPH, or benign prostatic hyperplasia. So we'll start with what is the prostate, what is BPH, and then go through kind of what are the different treatment options, and then maybe a call to action at the end. So what is the prostate? The prostate is a walnut-sized gland at the base of the bladder. It surrounds the urethra channel, actually travels through the prostate. It's important to men because it produces fluid that transports sperm during ejaculation. Young adult men in their early 20s, the prostate gland's around 20 cc's, and as they age, particularly in the 40s, 50s, 60s, and beyond, the prostate begins to grow. So some of the treatments or some of the different diseases that men can have in regards to their prostate include enlargement of the prostate, which is also known as BPH, or benign prostatic hyperplasia, prostatitis, and prostate cancer, among others. So BPH is abbreviation for benign prostatic hyperplasia. So benign, let's break this down. Basically, it means non-cancerous, although BPH can coexist in some instances with cancer. Prostate, or prostatic, related to the prostate gland, and hyperplasia means an increased in growth in the amount of cells in the tissue or organ. So in an adult size, it's about 1.5 inches, and it can obstruct the bladder, leading to bladder outlet obstruction that can cause symptoms of the lower urinary tract. So a lot of times patients will come in and they'll say, oh, you need to do a biopsy, or does this mean I have cancer? And BPH is not synonymous with prostate cancer. It is not the cause of prostate cancer. In some instances, the symptoms can overlap, although oftentimes cancer at the beginning stages would be asymptomatic. And PSA is a screening test that we use for prostate cancer, but it does not always distinguish BPH from prostate cancer. So other tests may be warranted, but that's kind of a webinar for a whole nother hour that we could go through. So what is normal versus enlarged? As the prostate enlarges, the pressure that can be put on the urethra in the bladder to cause urine to come out increases, such as right here on the right side of your screen. You can see that the channel of which it goes through is smaller because the prostate's larger, and then it kind of puts back pressure back up on the bladder. And the total volume of the prostate doesn't always correlate with the symptoms, or even sometimes the degree of obstruction. So what are some of the most common symptoms? Those would include frequency of urination, oftentimes both in the day and night, although some men may have more symptoms during certain times of the day. The sudden urge to urinate, such as urinary urgency, um, painful or burning with urination can sometimes happen if BPH leads to urinary tract infections or other issues as well. A weak urine stream. A lot of times I ask my guys, being from Ohio, if they're able to write their names in the snow. And that can kind of give you a clue as to how the urine stream is. And then after urination, some patients may sense that the bladder is not completely empty, or it can take a while for the patients to start their urine stream, or it kind of starts and stops while they're trying to go to the restroom. And then in more severe cases, it can lead to the inability to urinate at all. So BPH can affect quality of life. And many men who suffer from BPH may also experience a reduction in quality of life. Up to 95% of the men with moderate symptoms are unhappy and do not want to spend the rest of their lives with these symptoms. Half of men say that BPH interferes with some aspect of their normal life, and almost half of men experience sexual problems associated with lower urinary tract symptoms. So they can affect the patients and their partners' quality of life, routines, and relationships. And BPH is the most common prostate problem for men at age 50 or older. It affects half of men by age 60 and almost all men by age 85, 90% or more. And I'm sure the statistics now are even more impressive than this, but as many as 14 million men in 2010 in the United States had lower urinary tract symptoms. Some other risk factors, obesity or higher BMI or lack of exercise can also increase the severity or the risk of BPH. So how is enlarged prostate diagnosed? So it's both a clinical and physical diagnosis where the prostate exam, a digital rectal exam, can be part of the workup, or other urinary testing such as uroflow to see how strong the urinary stream is. And then a bladder scan or a post-void residual scan to see how well the patient's emptying. In men who are not necessarily high risk for prostate cancer or beyond the age where we would be considering screening for prostate cancer, I don't always do a digital rectal exam because a lot of times part of the workup may include a rectal ultrasound, which is even more useful as far as evaluating the size than my finger in a two-dimensional plane. So I kind of take it on a case-by-case basis. On self-evaluation of the symptoms, there's different surveys such as the AUA Symptom Index, the International Prostate Symptom Score, the Quality of Life questions, or the Bladder Impact Index. In some of these questionnaires, I have you, many of my patients, and if you guys have been to my clinic, you've maybe answered some of these surveys. So different treatment options. There's when I talk to patients, I say, there's basically 4 different options. There is observation or behavioral changes. There's medications. There's less invasive surgical procedures and more invasive surgical procedures, depending on what your anatomy and the evaluation and your specific medical history allows us to consider. So for behavioral modifications, drinking less fluid, or maybe if it's at nighttime, drinking less fluid at the night, watchful waiting, different exercises if you have overactive bladder or leakage, or physical therapy can sometimes be useful. There are medications, a variety of medications, but the 2 most common ones are Flomax or Proscar, the brand names, Tamsulosin, or finasteride is the generic. There are permanent implants or the prostatic urethral implants, or resume water vapor therapy. These are kind of the mainstay of minimally invasive procedures for BPH. And then there's more invasive surgical procedures, whether that's green light laser therapy or transurethral resection of prostate, or simple prostatectomy, which I normally do with a robot, where we can have smaller incisions and normally quicker recovery. Alternative medications. So when they've studied a plethora of dietary supplementations, there's no dietary supplement combination of phototherapeutic agents or non-conventional therapies are recommended as the mainstay of lower urinary tract symptoms to benign prostatic hyperplasia. This includes saw palmetto and Eurytica diacia. And sometimes patients ask me, hey, doc, I'm on this supplement. What do you think? And, you know, most of the supplements, if you think you've gotten benefit, I don't necessarily demand that you stop taking them, but there's not great evidence that any of them work better than a sugar pill when they've done randomized studies on these. So to go through more specifically some of the treatment options, we'll start with the less invasive and then kind of proceed with the more invasive. So watchful waiting. It may involve lifestyle modifications such as adjusting diet, evening fluid intake, elevating the feet, medication use, or exercise patterns. Most patients, if you surveyed them, only 19% were satisfied with lifestyle changes as the mainstay of treatment. Potential side effects are symptoms may worsen or remain unchanged. Your prostate may continue to grow. You may kind of lose that window where you can have a minimally invasive procedure to treat your symptoms and restore or maintain your bladder health. So the next one is alpha blockers, such as aflazocin or tamsulosin. And what do these do? They relax the bladder neck and the muscles in the prostate to allow urine to flow more freely. Majority of patients, 71%, stop taking their medication within a year. The benefits of this is that there's no general anesthesia, no permanent implants. Patients may require surgeries down the road. And if there's an anatomical obstruction, these medications don't always, relieve that. So the potential side effects are in some of the less specific alpha blockers. There's even been reports or papers that talk about increased risk for heart failure, drop in blood pressure, dizziness. A lot of times I'll ask patients if they're on these medications, if they're getting dizzy standing up after tying their shoes. In some cases, fatigue or interactions with other medications. And, just kind of as a housekeeping, when I go through potential side effects, this is not an exhaustive list, but this is a list of some of the more common potential side effects. So the 5-alpha reductase inhibitors. So what do these do? These help stop the growth of the prostate, the vascularity, and can, in some instances, shrink the prostate up to 30%. So they, examples of these would be finasteride or dutasteride, and their mechanism is they basically stop testosterone from being made into the hormone DHT, which is the DHT is a real big driver of prostate hyperplasia, so it drives BPH. So when patients are on these medications, sometimes the prostates can begin to shrink, but this can often take months or even half a year or longer to reach their maximal effects. And 71% of these patients stop taking their medication within 1 year. Potential side effects, In some patients, they can have sexual side effects, lowered sex drive, less fluid in the ejaculate or breast enlargement. And now kind of a new one is that we've recently found out that's rare would be, kind of psychiatric side effects with depressed mood. And sometimes that can last even after stopping the medication. So resume water vapor therapy. Now that we've kind of gone through the medical treatments, and a lot of patients can respond to the medical treatments, and for patients that are looking to avoid a procedure, those can be an option. However, with the side effects, a lot of times I like to encourage my patients, if they're good candidates, to really consider strongly one of these minimally invasive, so we can try to get the patients off their medications long term, because a lot of the side effects, the older the patients get, the more pronounced those side effects can be. So Resume is a newer over the past 10 years. It's become more popular, and it's basically uses water vapor to treat the prostate tissue and causes the prostate excess tissue to shrink. So for these procedures, I do Resume in the office. I don't require general anesthesia. Similar to the transrectal ultrasound measurement of the prostate, I use that same probe to put a local block of lidocaine, similar to the numbing block at the dentist office, to block the nerves to the prostate and bladder neck. And most patients do very well with that. We also put numbing agent into the bladder, and upon request, occasionally give patients anti-anxiety medications if they're interested in that before they get on the procedure table in the clinic. So potential side effects are painful or frequent urination, blood in the urine, blood in the semen, decreased ejaculatory volume, urinary tract infection, inability to urinate or completely empty the bladder, and urgent need to urinate. Most of these side effects are side effects that are noticed in the first several weeks. And as time goes on, patients really have an improvement in their symptoms, in these urgent need to urinate and painful and frequent urination significantly improves to the point where they can get off their medications because they're urinating so well. And also to the point where in one of the more well-known studies about Resume, the surgical retreatment rate through 5 years was around 4%. So over 95% of patients were either off their medications or not needing further surgical treatments. So this is kind of what the prostate looks like before with the enlarged prostate tissue. And this is what it looks like afterwards. The channel is opened up and a lot of this growth is improved. So I'm going to play a short video that kind of goes through and explains the procedure.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
Okay, so Resume, the one nice thing about Resume is it's a quick in-office procedure. Normally takes me about 3 to 5 minutes. We do, on average, somewhere between 4 to 6 injections. Um, and those each last about 9 seconds, the injections of the steam. And then afterwards, I place a catheter. Most patients will have a catheter for at least a few nights. If patients were unable to avoid coming into surgery because, or the procedure because they had urinary retention, I normally leave a catheter in for at least a week in that instance. In the Resume water vapor therapy, 97% of patients would recommend Resume for a friend, and that's based upon a survey of 255 patients. And here's a quick patient testimonial.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Resume procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Resume treatment has made a very big difference in our life.
So the nice thing about both Resume and this next therapy, prosthetic urethral lift or UroLift, is that most or basically all patients, they're going to preserve their sexual function as far as maintaining antegrade ejaculation where the semen can propel out, as well as erectile function. So these treatments do not impact the nerves responsible for erections, and they don't risk those, whereas other more invasive surgical treatments can sometimes have that as a consequence. So prosthetic urethral lift, what is it? It's an outpatient procedure that utilizes permanent implants to lift and hold the enlarged prostate tissue out of the way so that it no longer blocks the urethra. There's no anesthesia required. Although I normally do these in the outpatient OR where a lot of times patients are given sedation. So sometimes they do receive sedation or anesthesia. Potential side effects: painful or frequent urination, blood in the urine, pelvic pain, the urgent need to urinate. It's possible that if these are placed too close to the bladder neck, you can get calcifications or stones on them. The inability to urinate completely or empty or painful ejaculation. And one of the major papers on this, the surgical retreatment rate was about 13%, 13.6% at 5 years. And about 4% of that was patients that required additional urethral implants. So in the other nice thing about prosthetic urethral lift is some patients I can even see if they're urinating okay after the procedure. We can let them go home without a catheter, provided there's not a lot of blood in their urine and they're emptying well. So as far as green light laser therapy, what is it? It's an outpatient procedure that uses a laser to vaporize away prostate tissue. Most of these patients can go home the same day. Some patients on rare occasions would stay overnight in the hospital. It does require general anesthesia. There's no permanent implant. The surgical retreatment rate is just under 5% at 5 years. So this is a very nice option. Potential side effects are painful or frequent urination, which tends to be one of the more common side effects that I hear about this procedure when I've treated patients. And this can last sometimes around 4 weeks. The There's a risk of urinary tract infection, inability to urinate or completely empty the bladder, bleeding, urinary incontinence, scarring or narrowing of the urethra, narrowing of the bladder neck, the area of the bladder that connects to the prostate urethra, dry orgasm, and erectile dysfunction. Although with green light, I think erectile dysfunction is probably very low compared to some of the other more invasive BPH surgical treatments. And the other nice thing about green light is on some patients that are on blood thinners, the risk of postoperative bleeding is a little bit lower than that of transurethral resection of prostate, which we'll talk about. And that's because the laser helps stop any bleeding tissue. It kind of works at the same wavelength as hemoglobin, one of the main components that are in red blood cells. So this is a video that basically shows you the fiber here, and it literally uses the green wavelength of visible light spectrum, and using a scope, the urologist or I would introduce the scope into the urethra, into the bladder and prostate, and then we withdraw the scope back into the prostate and use the laser fiber to essentially melt away or coagulate vaporization that enlarged prostate tissue. Then afterwards, I leave a catheter, and patients can normally go home the same day and then come back to the clinic the next day or within a few days to have the catheter removed and make sure they're urinating okay. So the next one is kind of what some people would call the gold standard transurethral resection of the prostate. And it does work very well, and many patients have great success with TURP, but it is a more invasive procedure, and the side effect profile is a little bit more than some of the less invasive surgical options. So what is it? And it's an outpatient procedure that uses a heated wire or electrical energy to cut tissue from the prostate. It requires general anesthesia. There's no permanent implant. The surgical retreatment rate is around 5.8% at 5 years. And although we talk about surgical retreatment rates at 5 years for a lot of these procedures, including TURP, that doesn't mean that the procedures immediately stop working at year 5. This is trying to compare apples to apples and using a consistent time point and looking at high quality studies where we have good data for a patient population through 5 years. So potential side effects include painful or frequent urination, urinary tract infection, inability to urinate or completely empty the bladder, bleeding, urinary incontinence, scarring or narrowing of the urethra or narrowing of the bladder neck, dry orgasm or erectile dysfunction. And then one of the more invasive surgical options is prostatectomy. And what is it? It's an outpatient procedure. And oftentimes I have patients stay at least one night in the hospital after this procedure. That involves surgical removal of the inner portion of the prostate with either a robot or an incision in the lower abdomen. Requires general anesthesia. There's no implants. The surgical retreatment rate is low. Normally, this is because it's so invasive, is a procedure that would be reserved for patients with very large prostate glands that would require multiple stage procedures with other treatment options, or would have very low success rate with the other options. So potential side effects include bleeding, the need for blood transfusion, severe infections, scarring or narrowing of the urethra, narrowing of the bladder neck, urinary incontinence, dry orgasm, erectile dysfunction, or damage to the intra-abdominal organs, including the intestines. So as far as insurance coverage, just a disclaimer, that's the responsibility of the patient to contact their insurance provider for specific coverage information. Normally, if there's any issue, we will help the patients walk through this. The reps with Boston Scientific in my office. And very rarely has there been an issue where it's been an appropriate medical treatment where the patient has an insurance that we can't work out some resolution. So in summary, what is the prostate and how does it work? The prostate is a gland that's required for male sexual function. The channel through which you urinate, called the urethra, travels through the prostate. And as the prostate enlarges, known as BPH, that can block that channel, kind of like a donut getting bigger, but not just the donut getting bigger, but the hole in the middle gets smaller because the donut gets bigger. So the main treatment options are watchful waiting, first-line therapies, which would either be medications or even a procedure such as Resume or prostatic urethral implants, or surgical procedures, including green light laser, transurethral resection of prostate, or prostatectomy. So I know many of you guys are patients of mine or Dr. Howard's, or possibly interested in becoming patients or know a patient of mine. So if you have any further questions or are interested in making the next step to improve your urinary health and your bladder health, we can talk about what treatment options may be a good candidate for you in consultation with your urologist for a treatment tailored to your specific needs. And we can go through all the options. Briefly, here's a list of all the references that were used to populate the information on the slides. And I'll let you read those disclaimers here.